Hi, my name is Dr. Joel Guillemin. I'm a naturopathic doctor at the Center for Natural Pain Solutions in Winnipeg, Manitoba. I'm just here to talk a little bit about chelation therapy and specifically chelation therapy in cancer care. One of our most common questions we get is, what is chelation therapy? Chelation means to bind to and remove heavy metals from the body, metals such as lead, mercury, arsenic, cadmium, and copper. People often ask, what is the risk of heavy metal toxicity? Heavy metals can increase our inflammatory pathways, they can affect our immune system, and there's known carcinogenic properties when they're in high levels in the body. I also wanted to talk a little bit about specifically chelation therapy and cancer. Cancer prevention can be an important aspect of chelation therapy. With heavy metal toxicities, these increase our free radical risk and damage to DNA cells. There's also the carcinogenic properties of heavy metals such as mercury, arsenic, lead, and cadmium. Chelation therapy will be used to bind to these heavy metals and thus reducing our risk of cancers. During the treatment, the chelation is infused intravenously into the blood vessels. During this time, the chelation will bind to as much heavy metals and remove it via the kidneys through the urinary system. High heavy metals within the body are known as neurotoxins. They cause damage to nerve cells. During active cancer treatments, quite often our nerve tissue is compromised via the treatment protocol. This chelation therapy can be used as an assistant to remove the excess burden that the heavy metals may be playing alongside these other therapies. In addition to cancer prevention, we may also use chelation therapies during active cancer treatments as an assistant in removing some of these heavy metals. As I mentioned previously, heavy metals will increase our inflammatory markers, thus increasing the severity or the prognosis of the cancer. In addition to certain heavy metals such as copper will increase something called angiogenesis, which is essentially a buildup of new red blood vessels that supply cancer cells. By lowering our copper levels, we can reduce the blood flow to these cancer tumors. A specific example includes copper. When copper is high in the body, it increases a process called angiogenesis, which is the formation of new red blood vessels to the tumor site itself. This is how tumors become more aggressive by supplying more blood flow to the region. When we have high copper levels, this process is more extreme. When we're able to deplete that copper level through chelation therapy, we can help to try to prevent some of this from occurring. Another specific example involves a 2017 study looking at chelation therapy, specifically calcium disodium EDTA, which we use here in the clinic. Within this study, they used this chelation therapy along a number of different cancer lines, specifically melanoma cells. And from this study, there was a lot of promising results and a lot of indication for future research to be applied. Another example specifically around cancer prevention and chelation therapy is regarding cadmium. Cadmium is a heavy metal that we find in high pollutant areas in tobacco smoke. Cadmium is a known carcinogen that increases our risk of lung cancer as well as breast, prostate, and kidney cancers. Prior to receiving chelation therapy, patients will have an initial consult with one of us naturopathic doctors within the clinic. During that initial consultation, we will do a chelation therapy challenge where we will do a urine test following, determining what heavy metals are in the body and whether or not chelation therapy is appropriate for you. The typical process to start chelation therapy involves contacting the clinic and setting up an initial consult. During that consult, we will do an intravenous chelation drip followed by a urine toxic metal test. This test will determine what burden heavy metals are in the body and whether or not chelation therapy is appropriate. If heavy metals are high, we may follow up with regular chelation IV therapies. We've talked quite a bit about chelation therapy. This is just a brief summary of its role in potential cancer prevention as well as cancer treatment protocols. If you have more questions regarding chelation therapy and if this is an appropriate treatment for you, please contact us here at the clinic.